Have you ever been in an intimate moment, feeling the familiar rise of pleasure building inside your body, only to reach the peak and sense that something important was missing? The same intensity was present, the climax arrived, yet the physical evidence you expected was greatly reduced or did not appear at all. In that quiet instant, confusion can settle in like a shadow. The first time, you may brush it aside. The second time, the question grows stronger. Something begins to worry you, something you do not know how to talk about. This experience is known in medical terms as dry orgasm or dry ejaculation. Many men keep it to themselves because they feel unsure of what it means. A silent anxiety can grow in the background, especially when the mind begins to wonder about masculinity, age, or performance. These thoughts are natural, and you are not alone for feeling them. Many men across the world have felt the same concern, yet discovered that the truth is far less frightening than their imagination. Most importantly, it is not a sign that your manhood is fading or that pleasure is being taken away from you. In this detailed exploration by Man Health 360, we will calmly and clearly uncover the real reasons behind dry ejaculation, especially in men after the age of 60. Every point that follows is supported by medical research and real clinical understanding. We will separate rumor from science and offer practical guidance that can restore peace of mind. To begin, there is one essential idea that must be understood before anything else. Orgasm and ejaculation are two different processes that usually happen together but are not the same. A lifetime of experience may have made them feel like one event, but medically, they are two separate actions that work side by side. The orgasm is a neurological event. It begins in the brain and travels across the body through the central nervous system. It is a powerful wave of sensation created by chemical signals that trigger the intense feeling of release. Ejaculation is a separate physical action. It is a muscular reflex designed to push semen out of the body through the urethra. When both actions come together, your experience feels complete. A clear way to imagine it is to picture a grand fireworks celebration in the night sky. The orgasm is the brilliant burst of light that fills your vision. Ejaculation is the deep, resonating sound that follows. Throughout most of your life, both the light and the sound have arrived at the same moment. During a dry orgasm, the light still shines, but the sound is quiet or absent. The pleasure remains genuine. Your ability to feel that intense climax has not disappeared. Your body is still functioning, only in a different way. But why would the sound go silent while the light still appears? In many cases, the semen does not leave the body. Instead, it travels in another direction. The most common reason for this, especially among men over 60, is retrograde ejaculation. To understand it, imagine your urinary tract as a system of roads. When semen reaches the junction just before the climax, it normally moves forward, exiting through the penis. At that junction sits a muscular gate called the bladder neck sphincter. Its role is to close tightly just before climax so that semen can only move forward. In retrograde ejaculation, this gate does not close properly. It remains open, so the semen follows the path of least resistance and travels backward into the bladder instead of exiting the body. The orgasm remains strong, but the fluid takes a different route. This is a mechanical issue, not a performance failure. There are three leading reasons why this gate might stop closing correctly. The first involves surgeries performed on the prostate. Operations such as transurethral resection of the prostate often take place very close to the bladder neck sphincter. The procedure can affect the nerves or the muscle that control the gate, preventing it from closing fully. This outcome is common and expected in many cases after such surgery. The second cause involved medication. Many men over 60 take medicines for high blood pressure or prostate symptoms. Alpha blockers are common among them. These medicines are designed to relax muscles and improve flow, but sometimes they relax the muscle that should tense during climax. Certain antidepressant medicines can also produce this effect. The third cause is nerve damage caused by ongoing medical conditions. Long-term poorly controlled diabetes can gradually harm the nerves responsible for closing the bladder neck. Some neurological disorders can also change the signals that control this process. A simple indicator of retrograde ejaculation is cloudy or milky urine the first time you urinate after climax. That appearance comes from semen mixing with urine. It is harmless and will leave the body naturally. Let us look at the experience of Robert, a 65-year-old retired teacher. After undergoing surgery for an enlarged prostate, he resumed intimacy with his wife. The pleasure of his orgasm remained powerful, yet almost no fluid appeared. He felt confused, then uneasy, and finally ashamed. He didn't speak about it, and the worry grew heavy. He began to avoid closeness, fearing something inside him was damaged. At last, he visited a specialist. Dr. Jennifer explained that his semen was simply flowing into the bladder as a common result of surgery. Nothing about his masculinity had changed. His body was working differently, not failing. Robert described the explanation as relief that lifted a burden. Knowledge restored his confidence, and his marriage regained its balance. Retrograde ejaculation may be the most frequent reason, but it is not the only one. The second common cause is obstruction, also known as ejaculatory duct blockage. Using the earlier road example, this is similar to a roadblock set on the main highway. Semen is produced in the testicles, then travels through tiny ducts to mix with fluid from the prostate and seminal vesicles before leaving the body. These ducts are delicate and can become narrowed or closed. When that happens, semen cannot follow its normal path, and very little fluid reaches the urethra. Scarring from past infections may slowly build up over the years. Cysts or small stones can also create physical barriers. Unlike retrograde ejaculation, blockage may be accompanied with discomfort, pressure, or a dull ache during or after orgasm. David, a 68-year-old engineer, experienced decreasing semen volume over many years. Recently, he felt deep pelvic discomfort immediately after climax. He expected the issue to be part of aging. A specialist examination revealed a small cyst obstructing one duct. A minor procedure was performed to drain it, and within weeks, his discomfort disappeared. The semen volume returned to a healthier level. What he believed to be the effect of age was actually a straightforward mechanical problem. His story demonstrates the importance of taking any meaningful change seriously. The third frequent cause concerns the production process itself. Hormonal imbalance, especially low testosterone, can quietly reduce semen volume. Testosterone plays a central role in sexual health. It influences sperm production, semen quality, and overall sexual energy. When testosterone falls to an unusually low level, the body slows its production, and semen volume may drop enough to resemble a dry orgasm. This condition rarely appears alone. Men often notice low energy, reduced desire for intimacy, mood changes, and weaker erections. These combined signs point to hormonal deficiency. Consider the experience of Michael, a 62-year-old business owner. He felt drained of energy and emotionally distant from life. During the few moments of intimacy with his wife, the climax felt weak and produced very little fluid. He believed this to be normal aging. His wife encouraged him to seek a full medical check. Blood tests revealed very low testosterone levels. Under the supervision of Dr. Jennifer, he began testosterone replacement therapy. Over time, his energy returned, his mood improved, his libido strengthened, and semen volume increased. His health had not decayed. His hormonal system simply needed support. These three causes usually explain dry ejaculation, but there are times when immediate medical attention is essential. Certain signs should never be dismissed. If dry ejaculation begins suddenly without any recent surgery or medication change, a prompt evaluation is necessary. If pain appears during orgasm or afterward in the pelvis or testicles, medical help is required. The presence of blood in urine or in the small amount of semen should also never be ignored. Fever, chills, or night sweats after a dry orgasm may indicate infection that needs urgent treatment. If weakness in the legs, numbness in the genital region, or sudden loss of bladder or bowel control appear at the same time, medical evaluation must occur without delay. Knowing these red flags gives power, not fear. The vast majority of cases are safe and treatable, but safety comes through awareness. What should be done next? The first step is to speak with a professional. Reach out to Dr. Jennifer or your trusted medical specialist. An open conversation can begin the process of diagnosis. It may involve a urine test to check for retrograde ejaculation, blood work to assess hormones, or an ultrasound to look for blockage. The second step is to care for your overall health. Regulating blood pressure, managing diabetes, maintaining proper weight, and protecting nerve function all contribute directly to sexual health. The third step is to support the body with healthy daily habits. Regular walking strengthens circulation. A balanced diet rich in leafy vegetables, nuts, and natural antioxidants helps protect the body from internal stress. These actions don't promise miracles, but they give your body the environment it needs to work at its best. The message from Man Health 360 is clear. A change of ejaculation does not define your masculinity. It is not the closing of a chapter. It is only a signal from your body that something has shifted. Understanding that signal opens the door to recovery, clarity, and renewed confidence. With knowledge, medical guidance, and steady care, intimacy can remain strong at any stage of life. Your health is not measured only by volume. It is measured by awareness, courage, and the decision to seek answers when the heart is uncertain. Let knowledge be your ally, and your future will be guided not by fear, but by informed strength.